like to talk to you about gum disease, about periodontal disease, gingivitis, anything which has to do with inflamed and with infected gums, an infection, like a, that yellow, reddish, ugly pus, which kind of one has sometimes somewhere in the body. And that yellow, reddish, ugly pus is present in large quantity if a person has a gum disease. And the mouth simply happens to be the gateways to the blood vessels. Basically, it drips into the blood vessels very fast. And what I do not understand is why most dentists keep saying, if you have gum disease, you will be losing your teeth. Totally true. I got that. Not bad, not good. I got that. Very expensive. I got that. You should keep your teeth. I got that. But in the process, losing the teeth might take 2, 4, 6, and even 10 years. However, in that meantime, you're building up plugs in your heart, and you may get a heart disease because of it. No doubt about it. It's known for a long time. You may get Alzheimer. You probably have colds and flus way more often than other people because your immune system is down. You may ruin your kidneys and your liver. And how the heck do you replace them? This is not easy to fix those things. Ladies who are pregnant get premature babies underborn. How do you fix a premature underweight baby? So it looks to me that what is happening the 3 to 10 years till you lose your teeth is far more devastating than losing your teeth, because at least you guys are pretty good with fixing teeth with implants and everything else. Am I way off here? Tell me, Dr. Khaimov.
No, you are not. You're absolutely correct. Gum disease is horrible. It's very bad. It slows down your immune system. It slows down treatment of your diabetes, high blood pressure, your heart problems, your kidneys, your liver, all the major organs, your blood, because gum disease is a bacteria that opens up the vessels for all other bacteria to go into your heart, into your blood, into your major organs. So you start to go on a road where it's harder to fix your diseases. It's harder to keep your diabetes under control. It is, it causes more problems with a bad smell, your tiredness, your headaches, your getting sick more often, like a cold or a flu, or even some allergies. So gum disease should be under control. Gum disease is sometimes #1 cause of all those major problems, and very, very, very important to keep it under control, to keep your health under control.
Right. Like they say, heart disease builds up over a couple, 2, 3, and 4 decades. Well, the gum disease contributes to it building up. It's maybe not the and the only case, but it's heavy contributing, as you said, with diabetes. Because an infection in the body has obviously it fights every illness and every infection. Well, just like with wars, how many wars can the United States be in it and then start another one and still have enough soldiers and enough money to fight it? The body can only have so many immune soldiers out there, and if they're all used because a huge gum disease is here, that's not good. Tell me, when a person, I heard that the gum disease, the infection in the gum is very huge. Like, for instance, if a person has an infection on the skin, which is big like let's say a quarter or something like that, a dime, and if it doesn't go away, he probably goes to a dermatologist within a few weeks saying, oh, I have something here, what's happening? As he should, as the person should. But in the gum, apparently, the gum disease, I have heard, is as big as your hand. Is that true?
Yes, it is. And gum disease, it starts small for you not to see it first, but with time it goes bigger and bigger, and it's harder for you to treat. So that's why it's causing more problems. It lowers your immune system, which causes treatment of other diseases or treatment of your other problems much harder. So it's harder to prevent all the flus and colds and all the diseases with gum disease, because all your immune system is trying to fight that gum disease, and your gums become very bulbous, bleeding, ugly. You smile and
smelly probably too, huh?
Smelly, very smelly, and sometimes I've seen people they smile and the blood oozing down their gums,
okay.
And it's not nice, and the immune system really goes down when it happens.
Well, let's talk about the MDs. I think the MDs, and you tell me, from your experience, they're simply not telling. They know that gum disease causes a heart disease and all that, but they simply don't seem to be sending the average patients with a little bit of gum disease to the dentist, and they keep treating the other illnesses with whatever they treat them without handling one, not necessarily all, of the causes. However, the surgeons, the guys who do hip replacement or the guys who take appendix out or your tonsils, those people over the last decade or so have become much, much more aware of gum disease being a bad thing. I mean, they always knew that, let's just say, to take your appendix out, if it's not super acute or something, or to do a hip operation, if you have, let's say, a lung infection, they wouldn't do it because you have an infection going on. They would not operate because they know that the infection from the lungs or wherever you have it would go to wherever they cut and could infect that, and or that the body is so weakened that if you cut it somewhere else, the body cannot stand it, and again you create problems, if not the patient dying. Now, they knew that all the time, but it's lately, the last decade or so, that they also pay huge attention to gum disease, and they demand people to have a clean bill of oral health. They don't care about crooked teeth, they don't care about beauty, they don't care about cavities even, but they do want to have the gums healthy, because if they are not healthy, they don't want to do your knee operation, they don't want to do your appendix. They might take out a bullet of your heart if you get in it, they might not ask for it then, but rather than that, they want a clean bill of oral health. Have you noticed that this is happening lately?
Yes, I have. Even people with cancer, before they undergo the chemotherapy, they have to get a clean checkup from a dentist, right? Because if there is a gum disease, they cannot go through chemotherapy, because chemotherapy basically kills your immune system completely. So you have to make sure there is no gum disease.
Right. So basically what we're talking here is real that simple. A gum disease will bring your immune system down and kill just about every major organ in your body, and every little storm, every little wind, just a little, will cause you problems.
That's right.
And you just don't want to have it. Fix it. That's it. I had one dentist once telling me, people think it's relatively normal if there's a tiny bit of blood when they brush and floss. They go, it's just a little bit. They go, how would you feel if you comb your hair and you have a tiny bit of blood on your comb when you take it down? Would you still feel the same way? Yeah. And it's like, what makes you thinking that in there it is normal?
No, that's absolutely right. It's not normal. When you brush your teeth, the tiny bleeding and brushing, you have to run to the dentist and mention to the doctor, and it has to be taken under control, because gum disease does create problems and to your organs. So you don't want to end up with a heart attack only because you didn't take care of your gum disease.
Or lose your memory. About a decade or two too early. It's just not fun,
It's Good. Not fun at all.
Good. Well, it definitely looks like that the creator, whoever he or she was, we have this head, and he seemed to have put lots of important things in there: the brain, the eye, the nose, the ears. What makes us thinking that the teeth are any less important? He put lots of important things in there, and more and more it becomes obvious that obviously the whole body works in synergy, works together, and the teeth are really part of the big center. It's a big cogwheel missing, and it will bring the rest of the body to a grinding halt if it's not okay in one way or the other way, be it with the immune system, be it with headaches because it's out of alignments, be it bad looking and nobody looks at you. It's just absolutely super important. Maybe you guys are like the center of the medical field, and nobody has simply noticed it yet.
Maybe, but we're trying.
All right.
So,
thank you very much.
Just very important. You're welcome.
That's for sure. Very important for sure. Never mind whether it's the center or not. Very important. That's for sure. Thank you very much.